Good morning. My name is Alina Tamang. I'm a registered nurse today. So according to doctor prescription, I'm going to do head to toe assessment. So before doing assessment, can you do a 360 check? Okay. So I'm going to perform a hand hygiene before doing procedure. Could you tell me your two identification? What is your name?
John Paul Palaman,
Date of birth?
October 13, 1991.
Can I check your identification badge? Okay, it's matched to medical record. So before proceeding, I'm going to maintain a privacy for you. So I'm going to do a neurological assessment. So do you know where you are right now?
Seneca College,
Okay, what day is today?
October 19, 2024.
Okay, so who is the Prime Minister of Canada?
Justin Trudeau,
Okay, so I'm going to assess Porla. Can you remove your speak? Okay, so I'm going to do direct reflex. Okay. Consensual reflex. Okay. Now I'm going to do accommodations, so you have to focus on the tip of the pen. Okay. Okay. So can you smile for me? Raise your eyebrow. So can you repeat a sentence? Skies are blue.
the skies are blue.
Okay. So can you stand up for the pronator drift? So can you extend your hand? So close your eyes. So I'm going to assess 10 seconds for the pronator drift. I'm starting. Okay, thank you. Can sit. So while assessing the neurological assessment, my patient is oriented to time, place, and person. There is no facial dropping, no slurred speech. Pronator drift is negative, and while assessing a Porla, pupil is round and equal and reactive to light and accommodation. Accommodation is normal. So I'm going to do a respiratory assessment. So before doing respiratory assessment, I will inspect the posterior contraction and retraction of the chest wall. Okay, can you do a deep breathing? Okay, more. Okay, thank you. Okay, now I'm going to place my hand on the back. So can you do a deep breathing? Okay, it is bilaterally equal. Now I'm going to assess your lung sound. Anterior and posterior. Anterior in 10 points and posteriorly 18 points. Can you deep breathe? Okay, on the posterior side. So I ausculted the long sound entered and posterior. There is no adventitious sounds like cracking, crackles and wheezing. So respiration is regular and there is on labor. So now I'm going to assess cardiovascular assessment. So I'm going to auscult my patient's cardiovascular landmark of heart valve. So this is the clavicle. From here I'm going through the right intercostal, second intercostal space where there is aortic valve. In the same line on the left, second intercostal space where there is pulmonic. On the left third intercostal space there is Ip's point, and in the fourth left intercostal space there is tricuspid, and in the fifth intercostal space left mid-clavicular line there is mitral valve, and I'm going to assess apical pulse for 30 seconds. While assessing apical pulse, while ausculting apical pulse for 30 seconds, so it is 40 times 2, which is 80 beats per minute, and rhythm is regular. Now I'm going to assess abdominal. Okay. So I'm going to ask a question. Do you have any pain in your abdomen?
No.
Okay. So I'm going to inspect the abdomen counter. The stomach is flat and symmetry. So I'm looking from the side and from the bottom. And I'm also inspecting the skin, so it is appropriate according to the ethnicity. Now, before ausculting, I'm going to ask a question, like when you have a bowel movement,
This morning,
and what about passing of urine?
30 minutes ago.
Okay. So I'm going to auscultate the bowel sounds from the right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant, and I'm going to auscultate for the pulsation above umbilical for abdominal aortic aneurysm. So I did not hear any pulsation. So there is active bowel sound. Now I'm going to palpate bowel sound at the same auscultation. So right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. So I did not find any lesion, lumps and bumps, and no tenderness. No tenderness. So bowel sound is active. So I'm going to do a musculoskeletal assessment and skin assessment. So can you raise your leg? Okay. Can you raise your hand? Okay. So I'm going to inspect first the lower extremities and upper extremities. There is no edema, bruises, and do you have any pain in your upper and lower extremities?
No.
Can I touch? Do you have any pain?
No.
So there is no pain. So I'm going to assess a pulse. So carotid pulse on the left side. Okay. And dorsal pedis pulse in both legs, and posterior tibial in both legs, which are bilaterally equal and regular. So I'm going to check your muscle strength. So can you squeeze my hand? Okay. Can you pull? Can you push? Same on this hip. Can you push? Can you pull? Okay. So muscle strength is 5 plus. And now I'm going to see your nail for capillary refill. So while inspecting the nail bits, there is no any brittle, and there is no fungus, no any clubbing. So I check the capillary refill, less than 2 seconds. So I'm going to check a skin turgor in both hands. So there is no tenting. So I'm going to check a bony prominence on the heel. So there is no blanching and no wound and no pressure ulcers. The respiratory. So I checked the. I completed the musculoskeletal and lower skin assessment. So can you do a 365 check? So I completed my head to toe assessment. I'm going to hand wash. You can sit now. So thank you.